Balita ng katotohanan. Radyo Veritas 846 sa Radyo Katipunan 87.9 FM. Halina't makinig at makilahok sa mga isyu at usapan tungkol sa ating pananampalataya at lipunan. Radyo Totoo, Radyo ng Simbahan, Radyo Veritas sa Radyo Katipunan 87.9 FM.
Ready na ba kayo?
The Jesuit Hour. Get to know the Jesuits. Discover their spirituality, their history, their ministries. The Jesuit Hour. Anything Jesuit, everything Jesuit. The Jesuit Hour.
Do you sometimes feel confused or lost in the complications and complexities of life? Do you feel drained, listless, or exhausted from the daily burdens and responsibilities? Why not seek our campus ministers on air every Tuesday from 2 to 3 in the afternoon? Listen to our counselors from the Loyola School's Campus Ministry Office as they ground our lives in our faith, in our school's spiritual tradition. Campus Ministers on Air. Be guided, be inspired, be blessed. Listen to our Campus Ministers on Air.
JustCom Music Ministry. Music that uplifts the soul. Follow JustCom PH on Spotify and JustCom Music on YouTube. We are also on iTunes and Deezer.
This is your stop for all things pop. Catch our all-around pop culture geek, Cholo Sediaren, as he throws in some dose of what's poppin' and what's hot in the pop culture scene here on Popcorn. Munch in with us every Thursdays from 4 to 6, only here on Radyo Katipunan 87.9 FM.
To listen to music that uplifts the soul, follow JustCom PH on Spotify and JustCom Music on YouTube. Our music is also available on iTunes and Deezer.
Let us understand mental health and explore how we can take care of our emotional, psychological, and social well-being. Welcome to your weekly slice of mental health tips and tidbits with Pat and B, here on Mind Ed.
Sa'yo sumisilong kapag ang puso ko'y pagod.
Tara na't simulan ng inyong umaga sa mga magagandang refleksyon tungkol sa ating buhay at pananampalataya. Kasama sina Cardinal Luis Antonio Tagle ng Manila, Father J. Boy Gonzales at Father Nono Alfonso ng Kapisanan ni Jesus, Father Cali Llamado ng Manila Cathedral, at Binibining Risa Singson Kaupeng ng Light of Jesus Community dito sa Kapit Pandasal sa Radyo Katipunan 87.9 FM.
To listen to music that uplifts the soul, follow JustCom PH on Spotify and JustCom Music on YouTube. Our music is also available on iTunes and Deezer.
Radyo Katipunan is now online. See our live feed on facebook.com/Radyo Katipunan. Check out our Instagram and our Twitter at Radyo Katipunan and subscribe to our YouTube channel at Radyo Katipunan FM for more exclusive content. Follow at Radyo Katipunan in our social media accounts on Facebook, Instagram, and on Twitter.
Get your daily dose of inspiration through our music. Follow JustCom PH on Spotify and JustCom Music in YouTube.
Mga tinista at mga kapanalig. Ito ang balita ng kabutihan. Balita ng katotohanan. Radyo Veritas 846 sa Radyo Katipunan 87.9 FM. Halina't makinig at makilahok sa mga isyu at usapan tungkol sa ating pananampalataya at lipunan. Radyo Totoo, Radyo ng Simbahan, Radyo Veritas sa Radyo Katipunan 87.9 FM.
Ready na ba kayo?
Meron? Ano nga ba ang meron? Paano nga bang mabuhay ng tapat sa meron? Don't you wish you can relive your philo classes? The terror teachers? The terrible oral exams? Or the even terrifying but liberating and life-changing aha moments? Lundagin mo, baby! Here's your chance! Lundagin mo, baby! Kasama ang mga pilosopong sina Jovi Miroy at Ron Capinding. Lundagin mo, baby! Leaping upward, leaping forward. Lundagin mo, baby! Leaping to greater heights, to greater wisdom, to greater magis. Lundag na, Ateneo!
Lead X. X is for the extracurricular life of the Ateneo College students. X is for the X factor that transforms them into leaders, into men and women for others. X is for Lead X. Lead X.
Down from the hill.
All caps, mga Atinista, it's time to level up. Your talk variety program showcasing the best in media and other fields. As we feature the most loved personalities and the best practices of what we truly refer to as Magis. Together with multi-awarded multimedia guru Mr. Noel Ferrer, let's all level up every Fridays from 3 to 6 p.m. here on Radyo Katipunan 87.9 FM.
Level up!
Jesuit Music Ministry, your daily dose of inspiration. Follow JustCom PH on Spotify and JustCom Music on YouTube. We are also on iTunes and Deezer.
Radyo Katipunan is now online. See our live feed on facebook.com/Radyo Katipunan. Check out our Instagram and our Twitter at Radyo Katipunan. And subscribe to our YouTube channel at Radyo Katipunan FM for more exclusive content.
Katipunan.
Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Radyo, radyo, Katipunan. Radyo, Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng kwela. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Kawal ni Ignacio, Katipunero sugod, todo sa kayon, tulong at tulong. Lipat na Blue Eagle, galing giting nagigil. Blue and white, one big fight. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan.
The voice of the Blue Eagle, Radyo Katipunan 87.9.
Radyo, 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 OFW Eagle kami, di mapipigil sa pagbabalitang tumpa at tama. Buhay atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, Katipunan. Radyo, Katipunan. Radyo, Katipunan. Kawal ni Ignacio, Katipunero sugo, todo sa kayod, tunong at tulong. Lipad ka Blue Eagle, galing hiting at tigil, blue and white, one big fight. Radyo, Katipunan. Radyo, Katipunan. Radyo, Katipunan.
It's Joby Leroy at 3 o'clock every Thursdays. It's our RK Asks program. It's our science show, our science, technology, and society show here at Radio Katipunan, broadcasting from the south of Manila and with our colleagues from the University of the Philippines, Diliman. So you would like to greet our viewers, listeners, Docs Butch and Ben.
Hello, good afternoon. It's good to be back again. I missed last week's session, I think. I think we're about to have a good
Yes.
discussion on the latest updates today.
All right, we're looking forward to that. I wonder whether we're doing better or not. Doc Ben.
Yeah, good afternoon to the listeners. No, I
So-
wasn't able to join the
Explain-
broadcast.
There was
last
no
week.
broadcast last week. Explain
nga eh.
to our listeners, our viewers, your virtual background.
Okay, I have a new virtual background. Hindi na yung aking library of disarranged books. But this is Sisiman Cove. This is within Manila Bay. So I'm just telling people that Manila Bay is not just the bay walk. It's more than that. And this is near Mariveles, Bataan. And this is the cleanest beach in Manila Bay because it passed all the microbiological standards of the ENR. So it's safe to swim in Sisiman Beach because it passed the microbiological health standards for swimming. So it's the cleanest beach.
Can you get there from SM? From MOA, I mean. The ferry from MOA, it goes there.
I'm not sure kung pupunta pa siya eh. But the
Medyo so how do you get there from by land?
Well, you have to go to Bataan, di ba? Yung the road going to Bataan, you can exit at San Fernando or take the yung SCTEX. Okay, but don't proceed to Olongapo but exit at Dinalupihan. Then you just follow the Bataan Highway. Then it ends up near Mariveles, so it's before you hit the town of Mariveles, it's I think around 7 kilometers from the town. You take a left and go down the hill, and you get to the beach, the Sisiman Beach.
But I guess from Manila Bay, from what you call that port near CCP, you can go there from.
Yeah, kung may ferry.
like
I'm not sure
the-
kasi anong schedules ngayon eh.
Ah.
Kasi I heard because of the pandemic, they canceled the regular ferry routes. No? But before, I
right.
think you can,
Yeah.
before, di ba, I think you take
I
the
just
ferry.
want to know why that is your virtual background now. Why
Huh?
is that your virtual background?
Well,
why is that your virtual background now?
Actually, the Sisiman is famous for its there is an old volcano. Okay, that big mountain at the background. That used to be the heart of an old volcano. So it has a very dramatic landscape actually. Kasi Manila Bay we think is just di ba, parang flat lang yung surroundings niya without any mountain near the bay. This is the only mountain near the bay. That big hill at the background. So that's one of the tourist attractions really, aside from the beach. Oh.
Okay. So we'll talk about that some more later. But let's have our COVID updates. So are we doing any better or are we getting worse?
All right. Let me share my slides to give you the update. No? So this is the update up to September 15. No? We're still going to come up with a new one in a couple of days to next week. So
just for the sake of those who haven't watched us before, what's Octa again?
It doesn't really mean it's not an acronym for anything. Octa is 8 because it's a lucky number.
All right.
Okay.
Yes.
All right. So
but it's a group of researchers from UP, no? It's a group of researchers from Okay.
Yes. So up to the mid-September last week, we have had a steady decline in number of new cases in the country, with a short surge. I can't really call it a surge, no, but it has an increase, but still below the number of the lockdown, the pre-MECQ period. No? So this was the time that we released quarantine from MECQ to GCQ. So expectedly nagkaroon ng konting slight increase. Now the R value, it's good news. Mid-September, our R value is now less than 1. It's at 0.96. Currently, I think we computed it at 0.8 to 0.9.
Wow.
I think, for this week.
So it's steadily going down.
Fingers
crossed.
Yeah. For NCR, we see the same pattern, with a decrease after the MECQ and an increase after when we had the GCQ. No? Expected naman yan eh. And the R value of NCR was 0.92 at the mid-September time, but now I think it's 0.85 or 0.80 something this week, and we are already seeing a downtrend ever since the start of September, and I hope we can sustain that actually. No, our positivity rate mid-September was 11%. I think it's less than 10 now. No?
Yeah, based on the latest calculations.
But the goal is less than 5%. No?
Around less than 5. That's the WHO benchmark.
Okay. For Quezon City, the same pattern. It decreased after the MECQ with a slight increase when we released that. But I wanted to show you. Hold on. That slide. In Quezon City, there it is. No, in Manila, no, after we had the timeout of 2 weeks, no, bumaba talaga yung number of cases in the hospitals, no, and we want to see more of this downtrend in the hospital. It means that our healthcare capacity is no longer challenged. No? And I'll just skip that and go to our recommendations. No, here. This is the last slide. No, we identified some high-risk areas. So mainly Calabarzon, some areas in central Luzon. We have Zambales here, Tarlac. No, high-risk areas, Cagayan, Isabela, Benguet. In the Mindanao area, Agusan, Cotabato, Maguindanao, Misamis. No? Although there is a steady decline in number of cases, we still have NCR with the high risk area. No, we must understand that whenever we have a daily new case report, around 2/3 of that come from NCR. So if we are able to control the number of new cases in NCR, the whole Philippines will have a better outlook. No? Kasi in general, mas maraming cases dito sa National Capital Region. So that's it, no? That's my sharing for
So how do we explain the decrease, but then there's a slight the increase?
yeah.
So there's a
We
decrease.
yeah we had a decrease when we implemented our 2 week timeout. If you recall, the doctors asked for a 2 week timeout, and the effect of that lasted until the end of August. Now, when we released the MECQ and went back to GCQ, there was a slight uptrend. No? But I think we're able to sustain the uh, the R value below one. Well, that's good news.
So will you guys be recommending will you be recommending modifications in the quarantine?
Actually, we are talking about that in our group chat, no? And I believe that we can go to MGCQ soon, if not next week, no? We have sustained our R value for more than 2 weeks of less than one, no? And if we're able to sustain that further, so antay lang natin yung week na to, no? If we can sustain it further, we'll have evidence of a sustained downtrend. And I think, in my own opinion lang, no, not Octas, we can go down to MGCQ.
We are now in GCQ, no?
Yes, there are areas already in MGCQ. I think Laguna is on MGCQ.
But they have an increase, as you said. They have an increase in
Yeah,
cases.
meron silang increase nung nag-time na naging GCQ sila. Pero ang lesson naman, I think, dito is that the R value is sustained. The downtrend is sustained, no? And if we're able to have evidence of that for another week, I think I will be more comfortable already. I'll be comfortable already with an MGCQ.
Right. Not that that will change anything with what we'll do, at least as far as the three of us, four three of us are concerned. But
Yeah.
what does that mean? What will be the changes? Will there be more? Uh, what will be the changes that they can look forward to if it's really GCQ, MGCQ?
If it's MGCQ, we can have the transportation sector opening up a little more. Um, the current social distancing inside the buses, no, I think the buses and the trains can have greater capacities inside, no. When we eat at restaurants and we go to the malls, I think they will allow greater number of mga parokyano nila, no. So instead of 50% occupancy, they can now go to 70%. Some things we can look forward to is still no face-to-face classes. Wala pa rin.
Yeah.
No?
Well, that's really
So,
well. Now we are facing this possible slowing down, if not a shutting down of the internet. No? But we didn't anticipate to talk about that. That we are no longer suspending classes because of rains, but we are suspending classes because of internet connectivity.
yeah.
Any thoughts?
When I have my Zoom classes for STS, sinasabi ko sa students, this is how ironic, no? We are studying science and technology, and we are at the mercy of science and technology. So kapag when I am cut off, I automatically tell them, let's assume that I am cut off. When I am, you are virtually dismissed. And I will post your assignments in our learning portal
Really?
na lang.
Ah, right. Si Ben. Ben, are you
Yeah,
adjusting very well
okay
to
naman.
our new setup?
Yeah, we have our ano na. I try to make sure that the
There is
students yung contact, yung internet interaction namin na synchronous would be at not more than 1 hour because there's a cost on each student, di ba? To and the learning objectives will be more achieved if
yeah.
they work on their own time. Yeah. Now, in question kanina, I just like to add something about the MGCQ. No,
Yes.
once that is we have that in Metro Manila, because
Right.
other regions have that. Then we can go to Sisiman Beach. My virtual background. We can go there, subject to
Why
the
not?
quarantine
Why not?
regulations of the local governments. So most likely, yeah, Butch and I were being requested by one LGU to come up with potential guidelines for their town. It's a Batangas town that is much of its revenue is from domestic tourism. So but of course it's only at MGCQ that we can go back to the beach, no, and we have to come up with guidelines on what are the risks, no. um, Perhaps if you are socially distant, although we have to find out more information about your physical distances in the beach, perhaps you can take off your mask kasi you can't swim with a mask. Well, swim with a dive mask pwede. Okay, but swim with a face mask, I don't think you can do that.
If you're infected and you swam, will that infect the water?
Yeah.
That's a really
Well, if you
philosopher's
are
question.
most likely, if you're infected, then you will have to be isolated. ECQ, GCQ, or MGCQ, you will still have to be isolated. So there might
But if
be a
you're asymptomatic, will
well,
it will not contaminate the water? Will it contaminate?
no, there's no proof that you can transmit COVID-19 through the water. There's no proof yet.
Uh,
Yung by swimming, walang
except
evidence.
kasi, di ba, pag nagsuswimming, nagkakainan,
Actually,
where will the risk be?
yeah, the danger leisure activities outside is because it's more or less it's a social thing. So, di ba,
Yeah.
friends and barkada they will
People,
take their masks o
yeah, they lose
magkakaroon
their
talaga
guard and
ng risk. So maybe when we are allowed to go back to the beach, we're going to be aware that certain things that we used to do, we can't do anymore. Yung close nandun tayo sa isang picnic table tapos lahat tayo nandun. Baka hindi na pwede yun.
yeah.
Dapat,
In
oo.
fact, some rest houses have buffets, no?
Ah,
And that buffet, instead of you bringing food, they have this buffet, and then you eat in the like
yeah,
buffet, nga, di ba?
most
So
likely,
that will
uh,
not be allowed yet.
you will be given box lunches na lang. Alam mo,
That might be a
I talked to
solution.
a friend who's in the restaurant business. Sabi niya, one of the problems sa buffet is yung mga tao habang nakapila, they keep on talking to each other.
Yeah,
kaya,
yeah,
kaya
di ba?
kakalat yung yung di ba?
So face mask.
Maybe I don't know, but perhaps as I thought, we may be able to come up with new behaviors. Maybe if you are on a buffet table, no one's allowed to talk. Just get your food and get out. Di ba? Which actually takes the fun out of it. Oo. There's
Yeah.
but it's definite though. But of course, kailangan pa iset yan ng mga health authorities at the local government level. What kind what kind of activities could be allowed? Pero there's one thing that is sure, yung distancing. That is more or less I think will be the standard, no? Even on the
Yeah.
beach.
And I guess also the capacity. So from, di ba, we started with 30%, then
Oh,
50%, di ba?
yeah,
But
oo.
what about movie houses?
Oh, that's
Where
another
are
story. Maybe
people
Butch can answer
studying?
that.
Are people studying?
Oo.
All right. For movie houses, there's a couple of things that we have to consider. Number one, it's an enclosed space with air conditioning. No, when we began with this COVID protocols, no, at around March or February, we advocated opening windows in enclosed spaces. No, and if there's air conditioning, there should be a HEPA filter or a filtration system for the indoor air or the circulating air inside the room. No? And movie houses automatically will have to adjust to the circulating air inside and introduce vents. No? Secondly,
Kasi yung
um,
mga hotel, di ba? They are already allowed. So which means
Yes.
the air conditions have already been modified, have already been upgraded
The
in our
recommendation for ventilation is there should be a laminar flow of air, no? So air is pumped in through whatever means, the exhaust fan or air conditioning or electric fan, and it should exit so it doesn't cause stagnant air inside the rooms. It must always be flowing, no? Another thing is the seating, yung distance between the occupants. But it's really more about the circulating air inside the movie houses.
Pero
But
di ba may mga sinihan na that you're like in a kind of a almost a bed. You're almost like in a this high end movie houses where you're by yourself or with another companion, at least one more. But
The
that's a
lazy
kind of
boy.
an yeah. It's kind of a you're in a lazy boy, yeah.
Lazy boy siya.
Yeah,
pag nandun ako,
so
natutulog lang ako.
kaya nga, will that still, kasi kaya lang, oo, so that's not yet the social distancing that we want, or
Yeah. Baka I think they probably will have to design cinema seating na parang sa business class ng airlines na high end, di ba? Na may cubicle ka and you stay there in that seat.
yeah.
That's
So
those
yeah,
of us who can afford to pay for that fine. And I only
because I
experienced this
think that yeah, that it will
once,
be it
and
not I
that's
guess
after
in yeah, that's something that
oh,
they can think about. But are they discussing this? The movie theater owners, or that's not something that they are looking at.
They must be because I saw that one of the movie houses is open now, no?
Huh?
Or soon
Really?
to open.
Ah,
SM, I think I saw an ad in social media that it's going to open. So I don't know. They must be talking about it. There must be an association of movie houses, and I think they could be or with the MTRCB. I don't know, but I'm sure they're talking about it. They want to reopen the industry, lalo na sa MGCQ
all right.
period.
Now, Ben, did you see the audience of the Pope yesterday? And he greeted pilgrims in San Gandolfo. So the next question is, and I think our viewers and Jescom itself will be very interested. What about liturgical services?
church. Yeah, the church. Yeah, I think it's been discussed na, di ba, yung Catholic hierarchy natin are coming out with And I think some parishes like the UP parish kailangan 50% lang of the capacity of the UP chapel. Oo. And there will be parang social distancing. I think lalagyan yata nila ng markers yung pew ng X's. So you're not supposed to sit at the X.
But we do that now, right? We do that now. They do it in churches where there
Yeah,
are
I
only
know.
the
Oo.
specific seats that you can occupy.
Now, yung mga my friends from the Episcopal Church, they have a similar thing. Tsaka yung mga friends from the Methodist Church, they're trying to
Pero
to
siguro yung singing, di ba? That was
that's the
what they were
problem.
afraid of. The singing.
Liturgical church services involve singing by the
Oh.
congregation. So
Is that really going to be risky, singing?
yeah, because there is evidence from earlier part of the pandemic, yung mga church-related transmissions are happening within choirs. But there was a time na they even socially distanced the choir members sa choir, tapos 40% ng mga kumanta sa choir ended up positive, and the senior citizen members unfortunately were the ones who died. That was earlier this year.
I
So
see. So
meron
that was
talaga
the
evidence na
reason for the alarm, I suppose. So but with no singing, or at least solo singing na lang, that might be or canned singing, no? Recorded singing. We can see more regularization of church
yeah.
services.
Now, yung friend ko from the Episcopal Church, sabi niya na the choir might be, kasi di ba, with the liturgical reform, yung mga choir members with the congregation, di ba? That's how we do it today. But during the old times, nasa choir loft sila sa
And the
taas.
choir loft, that priest is his
Sa
arm is
likod
back
yun
on
ng
you.
church.
Yeah.
So baka daw
Yeah.
ibalik nila yun. The choir will be at the choir loft. Tapos the congregation will be at the pews at the ground floor of the ground floor of the church, di ba? Kasi like yung Protestant church sa UP, ganun eh, yung choir loft nasa
Eh
ano,
yung mga
likod.
mosques, don't they're supposed to wash before the service, no? Isn't that something that
Hindi,
is conducive to safe behavior?
yeah,
During-
that is part of Muslim practice, no? I think sa Muslims yata, I read something about it, even mga imams natin here in the country, no? They're going to, parang i-reduce nila yung capacity ng mosque. Besides, when you go to a mosque, dala-dala mo yung prayer rug, di ba?
You have
And
your
that
own
defines your
stuff.
prayer space. So they
Yeah.
will probably just to distance the prayer rugs.
Yeah, meron ng
So,
social,
hindi.
you define your
Yun.
space. Sa
So ano yun?
sa mga Katoliko,
Prayer
ano
distance.
meron pang holding hands,
Yeah.
so
Yeah.
there are many things
That's
that need to
that's
be.
ano, that's an interesting topic for science and technology, society and culture, and the cultures in religion. The nuances and the practices of religious ceremonies. No, actually, you're right when you talk about yung mga uh, in the Islamic faith. They do practice social distancing. They only pray within the area of their yung prayer rug nila, no? And they do wash their hands as a part of their ceremony before entering the mosque.
Yes. So siguro kasi we also have that, except that we have a communal holy water
Ah,
We can probably have our own we can
yeah.
restore that.
There'll be some changes to our, especially for the Catholics, no? Kasi Catholics have the practice of holding the images of saints and statues.
Pero itong question I always had, how dangerous is it really to receive communion?
Oh, did you ask your priest?
Of course, I have received because in a church near our house, they have their own rules. But I have received communion, no? Uh, but I stopped when things started increasing again. But is it really dangerous to receive it from
I
a
think
priest?
yung basic, I think for the Catholics, no, I think I heard that may directive yung isang diocese na yung mga magbibigay ng communion would have to, wala na yung giving communion by the mouth. Okay, wala na yun. So, mangyayari is everything will be given by hand. Tapos the communion ministers would have to wash and sterilize their hands. Oo.
At each time. Yeah, I do it. I carry my alcohol with me. As
Yeah.
well. But then
Oo.
the priest wants to hear your amen, which is kind of
I don't know. Maybe just a nod.
that's
Ganun na lang.
kind of dangerous, di ba? If the priest has to hear the amen.
Oo.
So I wonder whether liturgy should modify all those rules.
Definitely there will be a change in how Catholics will or anybody, whether Catholic or non-Catholic, sa kanilang religious services.
Sa evangelical, they distribute the cracker and the di ba?
Yeah, iba
The
naman
grape
yung
juice. So that's
But
also dangerous.
according to my friends from the evangelical, I have a kasama ko sa PhD program. After finishing his PhD, decided to be a pastor in a big mega church. No? Ang sabi niya sa akin, their biggest concern is the singing, kasi evangelical services are characterized by singing.
Yeah.
So
Paano yun?
manage that, yun yung isa. They were
All right. Yeah, but so we are looking forward to those changes where the rules will be less strict.
less strict, but still we will be under some sort of quarantine rules. Oo. Like yung sinabi ko nga, going to the beach, Hindi na tayo pwede in one picnic table. Iwalay tayo. Okay.
Yeah.
Ayun.
Yes. So, our topic this week will be the comparison, no, with other nations. Did you guys hear about this other, not yet a vaccine, but a kind of vaccine that they're developing in France, or is it Sweden or Switzerland, that they will inject the virus on some kind of a llama sort of animal, because they don't really suffer from it. And then they develop antibodies, and then they harvest the antibodies that they develop, and then they will turn it into some kind of a spray, which people can use. It's not a vaccine, but it's like a short term vaccine which people can use. They spray it, and then they don't get, the infection is less susceptible. And I think that's in Switzerland. And then there is, of course, the news again of the Chinese vaccine, the vaccine from China that is going to be tested in Peru. So is this what you are referring to when we're comparing COVID responses to different countries?
No,
Ben or
no, we did not get into that, no, kasi I'm participating in some regional reviews of the COVID science policy. Science, yung how they use the science for COVID response. Uh, at the moment, we were comparing yung how to implement the WHO guidance. Yes, kasi
yeah,
that's
there's
the
in
big thing.
fact the website has all the data, no, of the
Yeah.
WHO. Yeah,
Also, all UN member countries are actually legally obliged to implement in their various health ministries the WHO guidances, no? So that's ngayon, what we were trying to find out, discussing yung mga science advisors from the different Asian countries, is how did our governments approach it and what are the outcomes, whether successful or less than successful. Okay, let's be diplomatic, hindi man failure. Okay, something
with
more
varying
successful and
degrees of
less than,
success. Yes.
yeah.
Oh, Ben is becoming diplomatic.
So anyway, so we were assigned to look at the three countries in South Asia, which Pakistan, India, and Bangladesh. No? Considering that they have the more or less the same bureaucratic culture, being under the British for a long time, and they became independent countries. No, uh, and all of them have more or less something in common. They are although they're rapidly developing economically, there are still some parts of their health infrastructure and services that need a lot more work. More like Bangladesh, no. Bangladesh, yung public health system niya, it needs more investment. Although they are now investing a lot even before COVID, when their economy started to grow. Okay, so how did they approach the COVID problem? No, one of the first things that they did was to immediately, given the limited resources, is to test and isolate all possible people, even the asymptomatic. So according to the Bangladeshi representative, that is a big factor why their hospitals were not overwhelmed. Oo. And it's the
What kind of
similar,
test did they use? The
yung RT-PCR.
all right.
RT-PCR, because that was the one that was earlier recommended by WHO as the standard. No?
And they were
Yung
able
rapid
to do it at a mass scale,
hindi naman mass, widespread. Okay,
widespread.
it's
All
hard
right.
to, the word mass has a lot of meanings in different political systems, di ba? Even the Bangladeshis, they didn't want to use mass, widespread testing. Okay. Okay, I also was able to attend the one in yung discussions on Africa, Senegal, Ghana, and even Rwanda had
They were in fact very concerned,
yeah,
of how the pandemic is going to affect Africa.
Yeah,
because of the level of health
yeah.
services
Remember
there.
that Africa, because of colonialism, imperialism, has a less developed health system compared to
Yes, yes.
other areas in the world, no. But the thing is, what they were able to what happened in COVID-19 is their their strategies for suppressing COVID-19 was rather remarkably successful compared to
And
similar countries in.
what is the explanation? What did they do? Well, they also had some experience with it before,
Yeah,
no? Because of
okay. One
Ebola.
one big factor is that a lot of the emerging infectious diseases came from Africa. So
Mm.
their public health system was primed for it. That's one.
Yeah.
And Ebola has given them, and even Marburg disease has given them enough experience to respond to something else, something like this COVID. Although uh, Ebola never became a global pandemic, eh, di ba?
It was really
Oo.
there.
Yeah, but it's even more deadly than than COVID, no? Like Marburg disease, you can 89% of the patients will die, di ba? But they had this they were they had the experience. I think that was the factor. So when COVID-19, they just implemented their previous practices, so they're able to contain COVID-19 better than other countries, even with limited health resources. That's one country, Senegal, for instance, no, they meron mga international research organizations dealing with emerging infectious diseases. No, the government was able to link up immediately with them and come up with the sa kanila nga una nang galing yung 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 first application ng pooled
Pooled
RT-PCR
testing.
testing. So they were able at the unit of the village na isolate nila agad yan. So hindi na kumalat sa urban centers. Kasi once it spreads to an urban center, then it will be more difficult to suppress the pandemic. So just like Metro Manila is still the one that is the COVID-19 generator, as we can say, kasi maraming cases sa atin. In Africa, they were able to avoid much
I
of
see.
that problem. But not completely, much of that problem.
So
Oo.
it's the community organizing in in the villages that allowed Africa.
Yeah, yung public health authorities nila were able to intervene at the level of the village immediately. Oo. But the thing is, just like any country, no, Africa has a severe shortage of doctors. However, over the
Yeah,
yung
that's why there is doctors would go there, diba? To it's like their service.
yeah,
It's like their
but
community
their
service.
community health, marami na silang trained na mga nurse practitioners
Parang
and
paramedicals.
and other health workers na we can analogous to our barangay health worker.
So
Oh,
uh is that something, Butch, that we can adapt? What are the recommendations? Or what are the learnings from Bangladesh and Africa? But it seems the Middle East was uh, we get conflicting reports kasi, di ba? Like in Turkey or in
yeah.
Iraq.
But I did not I was not a part of the
Mm.
case discussions for Middle East and Turkey. Uh, so maybe I'll ask my friends who sat in that
Kasi that's why the OFWs came home, di ba? Because may Saudi Arabia and so are you getting some recommendations from there? Are there things that we can adapt from them? Adopt?
With regard to international experience, no, one of the things that made them successful was their swift implementation, early implementation, or ng guidelines nila, no, like lockdown, social distancing. They implemented them early enough, and then the decrease in the downtrend of new cases at that time, as early as May and June, has declined significantly. And we are practicing technically the same things. It's just that the timing their timings earlier, ours is a bit later. No? So they're also practicing quarantining, masks, social distancing, all the same. Without the vaccine and without a clear medical or clear drug against COVID-19, it's just all a matter of time. And Ben and I were discussing the political will with regards to implementation. No? Many countries have a premium on health, so they have longer lockdowns than our country. But we are already getting
I think Doc Butch got. So he's just
Yeah,
there. So he
he
will
ran out
join
of
you in
batteries.
your. You will violate social distancing rules. Uh,
Okay.
so so Ben, what are they learning anything from us?
Yeah, I think we're also learning much from them. Example, yung Senegal, I was really surprised about Senegal, no? Hindi sila nag-national lockdown kaagad. What they did, because they have the testing information, they were able to come up with targeted lockdown. So essentially, yung business centers were given the walang total lockdown until much later when they really had to go into a lockdown immediately to prevent further transmission from overseas. Yung mga ano, di ba? People flying in from ano. So essentially, they were able to come up with strategies that won't really totally shut down the economy. That's one thing that happened for Senegal. That's one. Tapos
But
second,
they also required to wear face masks and
yeah,
stuff.
kasi everybody has to follow the WHO guideline. And that includes mask and physical distancing and washing of hands, di ba? Those are basic and ganun pa rin. They were all doing that, no? Now, another important thing about Senegal is this, no? Given they had an idea kung paano kumakalat yung COVID, so they were able to have a well thought of way to reopen their economy. Hindi naman biglaan nagbukas. In-identify nila kung ano yung ibubukas muna at kung saan. Oo. But the problem, as I was told by the Senegal doctors, no, Senegalese doctors, is the second wave. Kasi there is a lot of Senegal nationals in Europe, di ba? They go to Europe, di ba? And they'll go back to Senegal, so baka mag-introduce ng bagong infection. Oh, yeah.
So that's
So
also.
mm,
So where do you think the gaps were if you compare the way we responded to COVID to how Senegal, Bangladesh, these are basically the same status
yeah,
as ours.
it's the
No?
governance culture. I think you know kailangan we need to look into that, no, how governance, kasi iba-iba yung governance, di ba? For instance, China was able to suppress it kaagad because they are an authoritarian country. Okay, then Taiwan,
No. They have social cohesion. So they have
yeah.
social cohesion.
Well, Taiwan, even though it's democratic, they had a long history of authoritarian effective governance. So when the Taiwanese president, si President Chai Ing-wen, ordered na ito yung gagawin, so everybody just followed. Nobody
But also
criticized
because
the Taiwan president.
they had
Ano?
what you call this, maybe the understanding of the health system because of the social cohesion was was really a system. In other words, that there was a real clear directive
From their
from
president.
that from where it's supposed to come, which is the expert, which we because people were saying that we don't have that, right? We
No,
don't
no.
know.
Okay, this is the nice thing I got from from all of these consultations ng international science advisors, no. Whether you are a European country in the EU or a country in Africa or Bangladesh or ano, governments do not utilize the science given by the medical scientists in this response for a host of factors, no, which I think maybe it's a good thing to discuss in another program, no. There's a host of
Yes, yes.
factors really. Um, some of them are in democracies, it could be political, or sabi nga nung chief science advisor of Poland, nung nagsalita siya for one of the meetings, no, of our science advisor groups, no, that governments were this is the first time in a long time that governments was faced with a major issue that could threaten the whole country or the whole nation, and they required science, no? Kasi dati science was just used to to develop certain parts of their economy. Like example, we want to develop the IT sector, then you get an IT, the government easy consult with an IT expert, di ba? And whether your IT sector doesn't develop as fast as you wanted to be or you want to develop, it won't kill your economy, di ba? But COVID-19 had the possibility, and probably it did almost kill economies. So it was just too much of a shock for a lot of governments. That was the theme, no? And that we need
And it was
more
not in
more
their it was not in their what you
yeah,
call
they couldn't
in their built, they were not built to consult scientists.
yeah, because until
And I
now
guess the science, yeah, yes, until now.
the science advisors from different countries, no, we're still thinking because it depends on the governance culture. Like for instance, in the UK, it's formal. Okay, there is a cabinet emergency body, yung SAGE, Science Advice Group for Emergencies, which is actually under the cabinet in the prime minister. Formal yon. In some places naman, it's in a lot of European countries and even in Africa, India, some Asian countries. No? Even here, they are ad hoc and in some cases informal. Okay? Even IATF as we have it here is ad hoc. So when this pandemic crisis blows over, IATF
And diba,
will
and
be
diba we were asking
disbanded.
nga where the NDRRMC was in the whole
Yeah.
setup
Now,
at the beginning,
yeah,
which was,
NDR.
and they were the ones supposed to respond to emerge to disaster.
Yeah, but this is a health
But was
crisis.
the understanding of this, so that is different. They didn't understand it as a disaster.
Yeah,
They
this is
understand, but risk management, diba?
uh, this came out to be a
But
public
they
health issue, and and health
yeah,
ministries worldwide did not recognize it as a health emergency. It took them 1 month or 2 months to recognize it as a health emergency. Di ba in the US
yes.
until now
But
hindi pa lahat recognize a health emergency siya. Oo.
yes. Did you hear anything from Thailand? Because that's also a very successful case, right?
Yeah, but
Thailand.
I wasn't able to attend the discussions on the ASEAN countries eh. Kasi ang
Be-
nangyari kasi people from the ASEAN countries nilagay nila dun sa South Asia. So we get to know what they're doing. But I think
they are
Vietnam,
failing, no? India.
alin? India, India has a problem. First of all, kasi malaking population ng India, and India is divided into different. It's a federal system, so the management of public health is given as a power of the Indian states. Doon nagkakaiba-iba yung doon, yung they have problems with that, no. Even though the federal national government of India would set the rules, the implementation will be at the state level. Okay? Whereas Bangladesh is not federal. Okay, it's a
I
unitary
think
system.
I
Oo.
think that's a very key information, Dr. Vallejo. So
Alin,
in
federal.
India, it's more difficult. Yeah, that it would have been more difficult because the federal state the state itself had to do the implementation.
Yeah, and also India is more ethnically diverse than Bangladesh
Yeah.
or Pakistan. Kasi, for instance, Bangladesh is overwhelmingly Muslim, So yun ang kanilang religious culture. Pakistan is the same, but India is not, di ba? India is composed of many,
It's
many
Hindu.
cultures. So
Yeah, and then Buddhist countries were supposed to have also responded better, no? Is there one thing that I noticed in the Thai response also is that the village health workers were key.
yeah,
So are we improving? Are we improving our barangay health workers' capacity to respond?
yeah.
Or
Okay. My experience in dealing with the barangay health sector is quite limited, no? Because when I'm a researcher, I'm doing environmental studies, no? Not the public health studies. However, for my from my experience with barangay health workers in the different places in the country, uh, some places, depending on how proactive the local government is, okay sila. They're able to document, like I visited this one remote island in the middle of the Visayas, no, na hindi mapuntahan ng turista kasi walang tubig, pero it's better than Boracay in terms of the beach. I just don't want to mention the name, baka mag-overwhelm sila sa tourists. So anyway, the barangay health worker, when I consulted with them, they had the list of all the cases, morbidities, mortalities, nilista yung malnutrition and mga ano. So let's say the doctor can only visit that community probably once a month or twice a month, yung municipal doctor. So immediately may information na, and the municipal doctor can easily instruct the health workers how to yung kanilang public community health response, no? In some places, the barangay health workers are not as efficient as that.
so
So
they
pag
have a
sinabi,
data, they have a database.
oh, so tinanong ko nga kasi sa water is the major limiting resource on that island. So if you have a major limiting resource of water, then the chances of your people getting sick of gastrointestinal diseases are high. So tinanong ko, marahing bang nagtatay dito,
Na
nagdudumi?
higher.
Oo. Pinakita na sa akin
Yeah.
mababa kasi they already know yung morbidity due to waterborne diseases, and they immediately implemented
Yeah.
community health strategies to lower or to lessen the morbidity rate. So ang morbidity rate on that island na walang tubig is just around 10%. That's quite low, 'di ba? For a remote community.
Right.
Oh,
Yeah.
there
So
are
that's really key,
key.
no? That's going to be key.
Yeah, I think for preventing future COVIDs and other
And
pandemics.
even in condominiums, 'di ba? If they could have their own health worker in each building, and I suppose each building would have its own, 'di
Yeah,
ba?
I am sure
Database on
naman
what
dyan sa
kind of
mga
risk people are
condominium sa urban areas, maybe there are some residents there who are doctors
who are
or or,
doctors,
or
'di
I
ba?
don't know, they can
But
be
and that's and, that's the reason why, yeah, in Thailand, because they have more cohesion. Yeah, there's in other words, there people know each other more, or people have greater interest in other people's business than in. I wonder if we have the same culture. Uh, in other
dito
words,
sa
they
atin.
don't resent when the uh,
Baka una
kasi parang yung sa disease is something that we hide, di ba?
baka on a
Kasi if you
particular
have,
community to community basis. Remember, one of the
yeah,
success stories here is Sagada, 'di ba?
uh-huh,
Sagada in Mountain Province, 'di ba?
province.
Oo, anong nangyari, 'di ba? They have only one or two cases. They were able to immediately and they prevented tourists from visiting even though it will hurt their economy.
And there's only one road kasi going inside.
Yeah. Also, the town is cohesive because isa lang yung major tribal group, 'di ba? And
Yeah.
also it's the people are almost all Episcopalians. They belong to one church, di ba? So,
That is something that so maybe the church can also be a force if it sees itself that way.
yeah,
That it can
as
be
a
a source of
community.
social cohesion.
Yeah, that the churches could fulfill their role na as agents of community cohesion.
Yes. So, is there anything else that you found out? So you've been attending these marathon meetings, and people are
It's
now
a series,
comparing.
it's a
So
series of
where are we
meetings.
now globally? Where are we now
Yeah,
globally in terms of
in
our
sa
response?
okay, the International Network for Government Science Advice, of which Dr. Butch and I are fellows, will come out with the report before the end of the year. Ito nga yung mga meetings to assess eh. There will be a global report that will be submitted to the UN hopefully before the end of the year. Kasi nagkaroon ng global survey among scientists who do research and also among medical practitioners who are really in COVID response. Oo. So, and the nice
Is
thing
the
about
idea of a public hospital crucial here? In other words, that the hospital is to serve the greater community in the
yeah,
response,
remember
or
well,
it
may
doesn't figure.
na-disconnect na kasi si Dr. Butch. He can tell more about,
Oh,
di ba there are levels of hospitals? You have your tertiary hospital, you have your primary care hospital, di ba? Things in
yes.
between. Uh, the strategy kasi I heard this from mga different developing countries is to make sure that the basic health unit of the community will be able to deal with COVID-19, di ba? Then yung mga other serious cases, then you refer it to the better equipped
Hospital.
hospitals, no?
Yeah. Which are
So,
normally private, di ba?
yeah. So ganito yung question, not necessarily. There are some
Uh,
countries in which the
yeah, I
government
mean in the
hospital
Philippines. Kaya
atin, oh yeah.
is that an important consideration that there is a more developed public hospital system?
Yeah, yung sa mga countries with a socialist leaning government, the public hospital system sila. But yung sa mga,
Yes,
mga countries na
exactly.
ganun, the strategy is preventive medicine eh. That's what I learned. Na? Even Bangladesh is yung African countries preventive sila.
Oh, so even if already during the pandemic, you really needed to know how to prevent transmission.
Then
Is that
it
what
will
you're
be
saying?
easier on the hospitals. Actually,
I see.
actually the
And we didn't
hospitals.
have that. We didn't
No,
have that mindset. We were at
we were not
curing.
we were not ready. Yun lang.
Yeah.
We were not ready for it. Uh,
Because
and we're not yeah, we're
we
not the
never
only
had this
ones,
kind of,
no. We're not the only ones. Almost all countries.
yeah,
Well, we can say all countries were not ready in different degrees, no. But what is amazing are the
yeah,
Africans. They already had experience with emerging infectious diseases, so
exactly, yeah.
they were able to
So that's
respond.
something to
Uh,
yeah. So the experience is the best teacher.
yeah,
Since
even with the lack of
it's the first time
doctors,
we experience it.
even with their lack of
Yeah.
doctors, their other health workers were able to respond appropriately.
But I hope indeed the important thing here is that we learn our lesson. You know, we don't just
Actually,
say, "Oh, kasi talagang hindi kami handa eh." And who was, di ba? Yeah, but we need to learn our lesson. We need to assess and to evaluate our response, even so, di ba? And prepare for the next eventuality because it will happen. If it happened in SARS, it happened in Ebola, something like this will happen again, and
no,
one can be sure.
the estimate is we will have a COVID-19 like pandemic every decade.
There you
That's
go.
there was
So
there was a study that was made, and that was made not 15 years ago. It was predicted after SARS that every decade
yeah,
we will have one or two big
yes,
pandemic
there you
that may
go.
threaten
So
global
yeah,
health.
so I hope that that's also part of our recommendations. That yes, we understand that everybody was caught off guard, but then we have to learn from it. We have to learn from it. All right. So
Yeah,
I don't think
and
Miss
that's the
Butch is not going to reappear behind you there somehow.
book
So you can
reappear. Kami si
Yes,
TPE
I
mo.
so we can say yeah. So let's call it a day.
Yeah.
We'll see each other again next week. Can we say our goodbyes to our viewers?
All right, me first, no? To our viewers,
Yes, yes.
we must maintain the downtrend, right? So we must practice the same minimal health standards even until MGCQ. And actually, that's a new normal. No? When I was asked by one of the students, until when are we wearing masks? And I told them, in other countries, the masks are really part of their culture. In Korea, there are designs, right? Mga nakaprint, no? And it helps prevent flu. It has prevented SARS from spreading that.
And cold, I suppose.
Yes.
Cold.
Yeah, so let's make it a habit already to wear masks, especially during flu season. And I heard Dr. Ben said a while ago that there will be occasional, regular pandemics like this, no, in history. In history, over the centuries, marami naman. And SARS is here to stay, like flu is. SARS 1 was. Now we have SARS 2. Perhaps SARS 3 is just around the corner. We must always be ready. Oh, that's
All
my
right.
message to everyone.
All right.
Bye.
Thanks, Butch, to you.
Yeah, my final message is, okay, most likely we're going to go on MGCQ, or else our Christmas will be totally screwed up. Di ba?
All right. So
uh,
we should just go on
yeah.
playing our
The
Christmas
thing
song.
is, we cannot have the same things that we were so used to. Okay, so let's prepare for that. For instance, sabi ko nga, I'm studying the ecology of beaches. That's really my research. Until I got involved with this COVID advice thing, no. When we go back to the beach, hindi na pwede yung kumpul-kumpulan tayo in one picnic table. Hiwa-hiwalay tayo. Mga
You must
barkada,
bring your own.
separate.
Bring your own. Your beach chair.
Oh.
All right.
If we
All
go
right.
Christmas party, perhaps we can have a Christmas party, but we won't be having all those, yung masyadong masaya. Maybe nakamask lahat ng tao. And definitely, baka wala ng buffet.
All right. Okay. So thanks, Butch and Ben. So Ben,
Okay.
see you. All right. Bye-bye.
Bye.
Thanks for listening. This has been RK Ask, and follow the minimal health precautions. See you. They saw you.
Katipunan